My name is Piawah, and I'm a gastrointestinal oncologist and an assistant professor in the Division of Hematology and Oncology, Department of Medicine at UCSF. What excites me the most about my job is really the opportunity to form these intense, often long term relationships with my patients. As an oncologist, I see patients really anywhere along the spectrum of their cancer care. And I thrive on the strength of the patient doctor relationship. I'm also excited by how fast paced the field of research in oncology is, and the opportunity to make a lot of really meaningful changes in years to come. My focus is on colorectal cancer, and my research interest is in colorectal cancer disparities, particularly those affecting racial ethnic minorities as well as underserved populations. My big picture ultimate research goal is to identify features of the diet or the gut microbiome that might impact the disparities we observe in colorectal cancer, and to identify potential targets of intervention or non-invasive screening methods to improve these disparities. I think that receiving this Watson Award is really important because it will provide the foundation upon which I can establish myself as an independent researcher and work towards this research goal. The research that I do is focused on exploring the roles that diet in the gut microbiome, which refers to the bacteria in our gut, play on the development of colorectal cancer and the impact that they have on the disparate incidents and outcomes that we observe among different populations with colorectal cancer. My research is personally important to me as I'm African American, and it's been well established that colorectal cancer does affect African American populations at higher rates than other racial ethnic groups. So this is work that will have an impact on me, my family, and kind of anyone who's African American. The research that I do relies on very strong partnerships, not only at UCSF, but with other providers and researchers at San Francisco General Hospital, as well as researchers nationally. In particular, my work on the microbiome is what I would consider transdisciplinary work because it really does cross different disciplines, including epidemiology, nutrition, as well as computational biology. And I've, over the past few years, really relied on strong collaborations with other researchers in those fields to move my studies ahead. And also because I'm particularly interested in working among and improving colorectal cancer outcomes for the underserved, I've made a push to open all of my studies at San Francisco General Hospital, which is a safety net hospital, in order to really provide exposure to innovative research for that patient population. I would like to thank my mentors, Dr. Vinook, as well as Dr. Treya, for all of their support, not only in my research endeavors, but also clinically throughout fellowship. And one of the reasons why I chose to stay at UCSF was really because I value their continued mentorship, and I look forward to seeing I look forward to developing my relationship with them even further.